I'm Jennifer Howard.
And I'm Lyle Johnson.
And we are occupational therapy students at Grand Valley State University.
And we will be presenting to you the Contextual Memory Test, aka the CMT.
The CMT test was created by Joan Toglia in 1993, and she is also the occupational therapist who created the dynamic interactional approach frame of reference. The test is about $175 and is primarily used with people with cognitive dysfunctions. There are three purposes to the test. It assesses three different areas of the memory: awareness of a person's memory capacity, the use of strategies, and the ability to recall.
Reliability for the CMT's recall scores were analyzed using traditional methods such as parallel and test-retest, in addition to rash analysis. The parallel form's reliability is a measurement of reliability obtained by administering different versions of the CMT to the same group. For example, in Part 2 of the assessment, the therapist gives the client two different contexts. One is restaurant and the other is morning. These are given as cues to the client. Reliability estimates for the parallel form administration range from 0.73 to 0.81, which demonstrates good reliability. The test-retest reliability is administering the same test to the same person on two different occasions, and the greater the similarities between the two equals the greater test-retest reliability. The quasi-test-retest reliability estimated was derived by correlating the immediate recall score with the delayed recall score. This estimate ranged from 0.74 to 0.87 for the control group, which is the group with no obvious cognitive impairments, and 0.85 to 0.94 for the group with traumatic brain injuries. This means there is a high test-retest reliability. The rash analysis reliability is the ratio of true variance to observed variance in the person's scores rather than on the correlational information commonly used in the true score model. This method of estimating the reliability supports that the CMT is in fact a reliable assessment tool. Good concurrent validity was established when immediate, delayed, and total recall scores were correlated with the Rivermead Behavioral Memory Test. The CMT may be administered to adults ages 18 and above with the following conditions: TBIs, cerebral vascular disease, dementia, multiple sclerosis, Parkinson's, AIDS, epilepsy, and this also includes mental health disorders such as depression, schizophrenia, and chronic alcohol abuse. This test may be administered in a various amount of settings such as hospitals, rehabilitation centers, along with outpatient clinics. However, wherever you're at administering this test, you want to make sure that there is adequate light in the room, that it is quiet, and that it is free from distractions.
To begin the test, the occupational therapist first gathers basic information about the client, such as their age, education level, and diagnosis. After this, the client is then asked a series of questions regarding their own memory capabilities. For instance, one of the questions is, how would you rate your memory capacity? Following some of the preliminary questions, the client is then asked to look at a picture card for 90 seconds. The picture card may be of morning items or restaurant items. Then, following the 90 seconds, the client is asked to immediately recall as many items as they can on the picture card as possible. Following the first picture card test, there is going to be a 15-minute delay. During this delay, the administrator of the test, the occupational therapist, asks the client the different strategies they used while completing the test. Finally, following the 15-minute delay, the occupational therapist once again asks the client the different items that they remember from the test. So this can look at their delayed recall. Now that we've given you some background of the test and the settings it's used for and who it can be used for, we want to talk about how this relates to OT and why it's a good assessment for the OT process. So it can be used as an initial screening tool, it can be used as an evaluation tool, or it can even be used to reassess a client after they've been given memory strategies. This test helps the OTs determine the rehabilitation program for their clients and what treatment sessions and interventions may look like. OTs can also use the test to learn what memory strategies that the clients use to remember things or compensate for their cognitive limitations. The OTs can use this information to capitalize on some of the strengths that the clients have or determine new strategies that they can implement or teach the client during therapy sessions. Occupational therapists may use the information from the CMT test to help guide therapy sessions. To begin with, occupational therapists need to determine how aware clients are of their cognitive limitations. This is important because some clients may not be aware that they have limitations and they need to gain the self-awareness before OT addresses cognitive strategies during interventions. As we have previously noted, the CMT test looks at 3 different areas of memory. These are recall, strategy, and retrieval. By taking the test, the OT can see what area that the client is having difficulties or limitations in, and then determine intervention strategies based on that. For example, if a client has difficulties with recall, this may impact the IADL of shopping, and they may not be able to go to a store and shop and determine what they needed or remember what they needed and be able to recall those items. So during an intervention, an OT may suggest the use of a memory book so that the client can create lists and then use that list when in the grocery store. So the CMT test can kind of provide the occupational therapist with information on the limitations or difficulties that a client is facing.
This test can be administered in 5 to 10 minutes. The CMT is easily transported. It can also be administered at bedside. It uses pictures that are everyday objects. It screens for memory dysfunction. It links assessment results with treatment and suggests ideas for additional testing. And finally, no examiner qualifications or certifications are needed to administer the CMT, although examiners should be familiar with how to administer the tool and certain protocols and understand how to use the assessment. This also includes providing cues to the client and identifying strategies to help the client optimize performance and good understanding of scoring and interpretation of the CMT. Additional research is required on psychometric testing. It is not a diagnostic and must be used in conjunction with other tests of memory and cognition, such as the Rivermead Behavioral Memory Test. The manual is lengthy and may be confusing to some readers. Scoring and interpretation of the results may be difficult for some individuals. The results may be affected by language or cultural barriers if the client is unable to recognize or name the items. Thank you everybody for watching our video.
And we hope you see how the contextual memory test is an important part of the OT toolbelt.